Good morning. The Canadian Liver Foundation is pushing for baby boomers to be tested for hepatitis C. Dr. Kelly Kaita, liver specialist and director of the Viral Hepatitis Investigative Unit at the U of M, joins us now. Good morning. Thank you for being here.
Good morning, Courtney. Thank you for having me.
So first of all, kind of recap the findings of the recent survey that was done.
Well, it was a large survey in which we surveyed 1,000 Canadians and 300 family physicians last year, and the results were just recently made available. And we learned several important key findings, but perhaps one of the most important findings is that those people born between 1945 and 1975 were the group of people that were less or least likely to be tested for Hep C, and at most or at the highest risk to have been exposed in the past. So like our US counterparts and our European counterparts, we're encouraging people born between these years to go out and get a single blood test for hepatitis C.
Why is their risk higher?
Well, a lot of it has to do with lifestyle choices back in the 60s and 70s when hepatitis C we really knew very little about. A lot of the lifestyle changes have changed because of our knowledge about hepatitis C.
What exactly is hepatitis C?
Hepatitis C is a virus. It's a viral infection that can attack your liver. And over a span of 20 or 30 years, about 20 or 30% of patients might end up with end-stage liver disease or liver cirrhosis.
Wow, are there symptoms related to it?
You know, believe it or not, a lot of my patients will walk into the office for the first visit and not having had any symptoms. The only reason why they were found is because they asked their family doctor for a test, they may have donated blood and got screening, or they may have gone for an insurance physical, and hepatitis C is fairly routine.
So you want everyone born between, 45 and 75, 1945 and 1975, to go for a one-time blood test?
Yes.
And how does the blood test work?
Well, the blood test is very simple. You just go to your family physician. It's just one tube of blood. It's sent to the viral lab here in Winnipeg, and it's a blood test where we check for antibodies against or toward the infection. And if it tests positive, it likely means you've been exposed, and it likely means that you actually have hepatitis C.
Wow. So are there still risks associated now? Like if you are younger, are the risks lower?
Sure. I mean, if you have ongoing exposure to the virus through lifestyle choices like recreational drug use, or if you've shared personal hygiene affects from somebody known to have hepatitis C, you have ongoing risks. So if you identify yourself as having ongoing risks, it's probably more than a one-time test that you need.
Okay, so the best thing to do is to go to your doctor?
Absolutely. Ask the right questions and I'm sure you'll get the right test.
Well, there you go. We'll put all the information on breakfasttelevision.ca about more on the survey results and more about how you can find out more information about getting the one-time blood test. Thank you so much.
Thank you for having me.
And that's BT Health for today.